London surgeons have become the first in the UK to perform a pioneering operation to improve failing hearts whilst they're still beating. It took place at King's College Hospital, where medics used what they call less invasive technology to treat the patient from Bromley. Alex Bushell has this report.
I couldn't walk. I was always in agony, my knees, my tummy, and it was getting worse. I was struggling to walk with stairs, and I was feeling in general very low.
Shevket Gursa can now enjoy long walks with his family, something inconceivable just a few months ago, when despite never having smoked or drunk much, he was diagnosed with heart failure.
I was very worried because you could come out, unless you come to that level, you don't know, but we all are afraid of death. You know, we may say we're not, but we are. And then you look at that possibility, and I had hesitations.
It's changed your life?
Yes, it's changed my life, yes.
And so much for the better. Each checkup charts his recovery since a time when his heart had swollen to twice its size. As a high-risk patient for the quadruple bypass he needed, he opted to be the first in the UK to have a procedure called cardiac sewing.
What happens when you have a heart attack is you develop a scar on the pumping chamber, and that means that the pump doesn't work very well. And by plicating, folding the scar out of the way, what that does, it allows the rest of the heart to work much more effectively.
And to do that, he used basically a wire with an anchor at both ends to seal off the dead heart muscle, reducing capacity but also increasing the efficiency of the heart's pumping. What's truly novel is that the heart never has to be stopped. As a result, recovery and success rates are hugely improved. And this procedure will now be trialled at hospitals across Europe.
Still a novel operation done by very skillful people. Obviously, these are hand-selected surgeons. But I think we need to wait and see the long-term data from a group of patients that have had this procedure before we can suddenly say, fantastic, this is an operation for all.
The result of all this, less invasive surgery and now no need to stop the heart. For Shevket, it's meant he's been able to restart his life. Alex Bushell, BBC London News.